Our contract expired into September last year, September 30th. They started bargaining well before the contract expired. So we have been in the process of trying to bargain for over a year now. We don't have a contract currently, so everything just defaults to our prior contract, but we don't have any new policies or anything in there written about say working conditions with COVID or the pandemic, right, which really changed the work that we do, which is primarily remote. So we're all working from home. We come into the clinic 1 day a week, but what that entails is much more indirect patient care, which means returning phone calls, returning emails, calling people in crisis, and just managing our patients, while we're not physically in the office. There's also such a higher demand and need for mental health care right now, especially since the pandemic. So we're trying to manage that as well while our colleagues and coworkers are leaving Kaiser. They can no longer keep up with the workload, the demand, the lack of time that we have in our schedules each day. So we are really just trying to get a contract that will allow us to see our patients more regularly, not wait 6 to 8 weeks as they are currently, as well as keep people within Kaiser wanting to work for Kaiser and not leaving. In the last year alone, we've had 400 therapists leave, and they've only replaced 200 of those therapists total. So we're still down quite a bit. Unlike physicians, we do not have a cap on our caseload. A lot of times panels for physicians close. They no longer taking new patients, whereas each of us, any full-time employee is taking 5 new patients a week. So every day you work, you have a new patient, but nowhere to put them. So that's why the appointments are out 6, 8, 10 weeks. So I may introduce myself to you today. Hi, I'm your therapist, and I will schedule my next available appointment. But again, that may be 2 months down the road. So that's really not sustainable for us as the workers who are trained to see people weekly. That's the standard of care. But also for patients. If you are struggling, if you're in crisis, you need to have access to your therapist, to the care and treatment that you're paying for. Managers and the front desk staff are all canceling appointments, canceling new appointments, canceling return appointments, canceling our groups, and they're really just operating on a crisis basis. If somebody's having a crisis, they tell them to go to the emergency room. We do really want to see patients be seen more frequently and within the parameters of the law. We've already agreed to the economic plan. We are not out here for money. So although we're losing money by not being paid, that's not the point. We can't return to work until we know that we have the ability to see our patients within, that 10 days. Or have some movement. It can't be 6 to 8. People are suffering. Specifically in Vacaville, we have a GoFundMe. GoFundMe is at VAC_strike_fund. Or you can just Google Vacaville Psychiatry Strike Fund. And then our Venmo is at VAC_PSYFUND. And almost all of our social media is under that as well. So we have an Instagram, TikTok, Twitter, and it's all at VAC_PSYFUND. VAC Psy Fund. We disseminate funds based on need to our therapists directly.